parliamentary whatever residencies, challenges of having a full connection. So I will rely on you to indicate who of the members of the portfolio committee are present, so that also becomes part of doing the register or roll call. Thereafter, I will hand over to the NHLS board chair and the CEO. But for now, Ms. Machalamba, if you can lead us through that.
Thank you, Chair. Present is Dr. Dlomo, Mr. Munyai, Ms. Kela, Mr. Sokacha, Dr. Jacobs, Ms. Wilson, Ms. Ishmael, Dr. Tembe Kawayo, Ms. Chirwa, Ms. Lengwa. That's all, Chair. The apologies are from Mr. Van Staden and Ms. Sukers. Thank you, Chair.
Okay, thank you very much. Can we now hand over to NHLS board and the CEO, whoever will start, either with introductions and then the presentation. We would appreciate the presentation not to go more than 45 minutes, so that we can get an interaction, so that members can get the time to interact with your presentation, Dr. Chetty, and then you can come back again to clarify questions asked. Okay, let me give it to you now. Thanks.
Thank you very much, Honourable Chair and Honourable members of the Portfolio Committee. Let me start. I'm Kami Chetty, the CEO, and in the boardroom we've got our full executive team as well as online. So we've got Mr. Jonas Shai, who's the CFO, Mr. Johnny Mofokeng, who is the acting HR executive, Mr. Tashin Doki, who is the finance manager, Mr. Seni Shlongwane, who is the IT executive, Professor Koleka Mulasana, who is the executive for Aqua. We've also got Ms. Doc Makonazi, who is from finance, Ms. Violet Gabeshane, who is the senior manager for monitoring and evaluation, and Mr. Nzi, who is the communications person. Online, we have got Professor Adrian Purin, who's from the interim director for the NICD, he's acting, and Dr. Spo Khalamono, who's the director for the NIOH. We also have Advocate Impo Mpelo, who's the company secretary. So Chair, those are the executive team. We invited everyone to this meeting in order to be able to participate in the presentation of the APP. And if I can ask that the board members, we've got Professor Eric Book, who's the outgoing chairperson, and we are still waiting written communication from the minister with regard to the board. And I will ask Professor Jeffrey to also introduce the board members who are present. So can I hand over to Prof. Jeffrey to do the introductions for the board members? Thanks, Chair.
Good evening, honourable members. Thank you, Chairperson, for inviting the NHLS to present the APP. It is my pleasure to introduce the members of the board who have joined us today. So we have got Professor Eric Bush, as been mentioned already, and we have got Professor Tanyani Mariba, who is the chair of what we call National Academic Pathology Committee. And then we have got Professor Mary Ross, who is the chair of the Research and Innovation Committee. And then we have got Ms. Spiwe Mayinga, who is the chair of Remuneration and Human Resource Committee. And I think these are the board members who have joined us this evening. And just to say that we welcome this opportunity to present our APP. And I think from my side, I'm going to invite Professor Eric Bush to just say a few remarks before we hand over back to the CEO. Thank you very much.
Thanks very much, Prof. Mphahlele. So my role this evening is just to provide a bit of context to the APP and the budget that Dr. Chetty will present on behalf of the NHLS. I think that in terms of the context, I think it's important to recognize that back in 2017, we only had a 200 or 300 million rand in the bank at the beginning of each month. If we didn't get income coming in that month, we would have struggled to pay salaries. We would have struggled to pay our suppliers. And in fact, at that point, we had an accrued debt to our suppliers of about 1 billion rand. At the beginning of the COVID pandemic, over the 3 ensuing years, we had built up a bank balance of 4 billion rand. We had cleared our accrued debt to all our suppliers, and we're paying them in less than 30 days. We had managed to achieve that without big hikes in our fees. So we would generally keep our fee increases at 5% or below per annum, and maintained our service standards as a national platform in the interests of our people. And I think that is an important base. That positioned us well to respond to the COVID pandemic and to make heavy investments in the equipment, the laboratory test equipment, the laboratory test kits that were required for us to respond to the COVID pandemic without having to ask Treasury for money for it. And so our bank balance is now closer to around 2 billion rand because of the investment. Our finances are much tighter as a result of that. It has been a tough year, the last year, because our test volumes, of course, have gone down because tests like HIV and TB, where we get very high volumes, have reduced during the COVID pandemic. But we have still remained in a strong position, both in terms of service delivery through our national platform. And I think that's important to recognize that as opposed to the private sector, who provide services where the money is, we provide care where the people are. And that means that we go into deep rural areas, which are costly to collect samples from and drive them hundreds of kilometers, which a private business would not be so invested in doing. So from our side as the NHLS, we want to really appreciate the support we've received from the Minister of Health, from all the provinces, and the provincial MECs who've continued to pay, largely continue to pay us during the pandemic, which is critical for us to maintain our services. And in particular, appreciation to the board, who have been very, very diligent and committed in their duties, as well as to the CEO in particular, who's led the organization in a very complex and challenging time, and to the executive team that has worked really tirelessly, as well as all the staff of the organization. And then finally, of course, our congratulations to Professor Koleka Mlisana on being appointed by the minister as the chair of the Ministerial Advisory Committee, which brings further honor and recognition to the NHLS. So I'll leave that by way of introduction and hand back to the acting chairperson of the board, Prof. Jeffrey Mphahlele.
Thank you very much, Prof. Buch. I think it's time to hand over to the CEO, Dr. Kemi. Dr. Kemi.
So thank you very much, Chair, and once again, greetings to the Portfolio Committee. Chair, if you don't mind, I'm going to switch off the video because it'll save bandwidth and present from there.
Yes, go ahead, Dr. Kemi, that's fine.
So Chair, can you see the presentation?
Just put it on a slideshow for now. It's not showing like that. It's showing, move it to make it a slideshow. Then yes, now it's fine. Yeah.
You've got it. Okay. So Chair, as you've said, in the interest of time, I'm going to be skipping over some of the slides. You have got the presentation, and many of you know the organization very well. That the NHLS was established by an Act of Parliament in 2001 with 3 mandates of providing diagnostic services, doing health research, and doing training for pathology. We're the largest public health service with 233 laboratories in the whole of Africa, and also internationally we compete quite well. You're aware of the institutes of the NHLS. I'm not going to go through the details of each one. The National Institute for Communicable Diseases, National Institute for Occupational Health, the South African Vaccine Producers, and the Diagnostic Media Products. So each one of these institutes, both nationally and internationally, are well renowned for their work. In particular, the National Institute for Communicable Diseases is well known for the surveillance and monitoring of communicable diseases. I forgot to mention that Professor Adrian Purin, as the director, is part of this workshop or this meeting as well. Chair, the national footprint, we've shown you this slide. We've got a presence throughout the whole of Africa. And whilst it may seem to be sparsely distributed in the Northern Cape, that's because of the geographical area and expanse of the whole area. But we're the only pathology service that basically covers the whole of South Africa. And whilst these may depict laboratories, we cover every single clinic in the country, and I think that's quite an achievement. Our operating model, our 233 laboratories service about almost 5,000 health facilities. We've got a presence in every region, and we've combined certain regions. So we've got 6 regions that we operate from. And in each one of those regions, we've got business units with academic facilities, one in each academic facility, and then others covering the rest of the service. Chair, in the chairperson's overview, which we've summarized here, I think we often forget the fact that about 70%, but in South Africa, we think the estimates range between 85 to 100% of all clinical decisions and patients' diagnosis are made through pathology and laboratory services. And this is extremely important because even with the treatment and the monitoring of patients, it's absolutely dependent on pathology services. So we play a central role, and without pathology services, we're very much aware that the whole health system could collapse without having pathology services. We cater for mainly the public population, which is about 80%. We also cater for a small amount of the private sector. And everybody's aware of the role that we've played in COVID-19, both in testing and surveillance. We also have been striving to ensure that there's good governance. We've got an unqualified audit opinion, and we're continuously striving to ensure a corrupt-free organization. We're also very much aware that we're going to be competing in an increasingly competitive environment with the implementation of the National Health Insurance. And because of it, we then continuously strive to improve our services to become a lot more efficient and much more cost effective, with very, very good competitive pricing and very quick turnaround times, with very high quality service that we're known for. So we're well placed to be able to compete for services based on these efficiency issues. Chair, I'm going to skip through the legislative and other mandates. I think we all well aware of the various pieces of legislation, more so the Portfolio Committee, which has passed most of this legislation, and then also the various plans that we work within, including the recently passed National Public Health Institute of South Africa, which was passed by this Portfolio Committee. Again, the Portfolio Committee is aware of our vision to provide high-quality laboratory services that is clinically efficient and cost-effective. And our mission, you're also well aware of. I'm not going to go through the details, but we do strive to look at state-of-the-art technology in order to provide on our 3 mandates of teaching, training, and services, diagnostic services. Chair, I'm not going to go through this slide. These are our values, and the Portfolio Committee members could read through it at your leisure. The APP also then looks at the situational analysis. We examined a number of external factors. I've spoken about the important role of pathology and laboratory services in healthcare. Not just in South Africa, but internationally. We looked at the burden of disease in order to be able to guide our APP, and more especially with regard to communicable and non-communicable diseases, as well as trauma and injury. We then looked at all the internal factors that we needed to analyze, and these were some of the internal factors that we looked at. I'm not going to go through the details. We did a very detailed SWOT analysis that was first conducted with the board members and then the executive committee, so that we could look at what our strengths are to be able to capitalize on our strengths, our weaknesses, and the risk mitigation strategies we needed to put in. We looked at what our various opportunities and our threats are in order to be able to use that to enhance the NHLS and strengthen the systems. We did a very detailed analysis on stakeholder analysis, as this is extremely important for an organization like the NHLS, which deals with multiple partners, but I'm not going to go through the details. So, Chair, to come to the crux of the issues, our expenditure estimates. These expenditure estimates were done at about October last year. So some of the figures may have changed over the last few months, but we kept it as it is because that's what is given through to the Portfolio Committee. And Chair, when we report on our annual report, we will then give you what the actual figures were at the end of March. So I'm going to just concentrate a little bit on this slide. So we looked at the volume increase and we budgeted for a -1%, so a decrease in our volume, primarily because we did get guidelines from Treasury that had asked us to look at cutting our budgets by 5%. Most of our revenue comes from volume. However, the forecasted amount was -5% as at October, as I said. And that's because of the decrease in 2020 around the test volume in the other tests. And that figure may have changed with the actuals, but as I said, I'm not going to be giving you the actuals now. Then we had a very small tariff increase, and Chair, we need to point out that the tariff increases over a period of time has been kept low by the NHLS over a number of years, because we believe that we need to be able to give back to the provincial health departments and the national health department. So we had At that stage, it was just an inflationary increase as we calculated it at October. We also had a very small labor increase that hasn't been paid as yet, as has been pointed out by the outgoing chair. And then I'm not going to go through the details, but just to say that you will see that the average test price did increase in the forecast in 2021. I need to point out that the cost of PCR tests is higher. However, what I need to point out is that we have been giving it at a very low price to the state, but the actual price of the test kits has been quite high. And when you compare what we provide to the state, our PCR test costs 507 rands as compared to the private sector that charges 850 rands. So you can see that we're extremely competitive. We negotiated prices down in order to be able to give a competitive price. Our test revenue, we budgeted at 8.6. The actual was higher, but that needs to be weighed up against the expenditure. And for the medium term, we have budgeted 9.8 million for that. You can see that has decreased in the following years. And I'm not going to concentrate on the other amount here, which is quite big, is because of funds that we've raised from the Solidarity Fund in the forecast. And you can see that we brought it back down to 377 million for 21-22. With our transfers, we have been informed by Treasury in our allocation letter that the conditional grants, those are the transfers, has been cut by 15.9%. So that's almost 16%. And as a result, you can see that the amount has reduced. So has been reduced year on year. So it's 16% versus, and then the next year it's another 1% that has been decreased by. Now this has implications, of course, for the budgets of the NICD, the NIOH, and our teaching and transfer grants, because we will need to look at the work of these the two institutes in order to be able to come in within budget. So what we have done is, you would notice that we have looked at trying to see whether we could get revenue from others, such as donor funding, such as other streams of revenue, in order to be able to compensate for it. We're also very committed to looking, and we've been continuously looking at cost containment measures so that we will be able to cope with this cut. And we're very, very cognizant of the fact that it's not just the NHLS whose conditional grants have been cut, because this impacts on all the provincial departments, all government departments, because of the deep recession that we're going into. Okay, and then Chair, again, our forecast at this stage, we would ask that this is seen just as a forecast, because our expenditure for COVID exceeded the revenue that we had budgeted for, but we have been putting in various measures to look at reducing this, and through our increase in other sources of revenue, we've been trying to make sure that we break even going forward. Okay, so Chair, I'm not going to go through the details of each service. Program one is what we call the laboratory services, but I'm going to just quickly run through what the KPIs for this service are. I'm not going to go through every detail, but they center around the service delivery model, which we are looking at the best service delivery model in order to improve on efficiency. In order to improve on efficiency, we're also looking at a specimen tracking system, which will vastly improve on our turnaround times. We've then given details of turnaround times for most of our priority tests, including the high volume tests such as the full blood count, the urea and electrolytes. We're also looking at the implementation of a point of care testing plan. We believe that it is quite important that we look at this innovative technology. We're also very much aware that point of care is life-saving. So for example, troponin and the detection of the cardiac markers saves people's lives from heart attacks because we're able to pick that up immediately. Importantly, in order to look at the modernization of our services, we are going to be looking at the implementation of digital pathology. Digital pathology or telepathology is extremely important. So we would be able to, for example, take a specimen of tissue in one laboratory and project it to a laboratory. If we take it in Johannesburg, we project it to Durban, and we'll be able to get the advice of the anatomical pathologists there. And there's lots more that we can do with it. And we think that the whole digitization is going to be extremely important. This program won budgets. The budget has increased overall, but that's because of our increased revenue. We will have to be adjusting it for the cuts that has been given to us. So I'm not going to go into too much of details here. Second program is academic affairs, research, and quality assurance. I'm not going to go through the program purpose, but AQUA deals with all of the tertiary facilities, the academic platforms, research, and quality. And the KPIs looks at the audit of laboratories for quality compliance. It looks at proficiency testing schemes. This is important because we check the quality of our tests and the test kits on a regular basis. Then we also look at the status accreditation of laboratories. Our aim is to get all of the national central laboratories accredited. There's only one laboratory that's outstanding, and we'll be able to achieve that. And we are pushing for the provincial, tertiary, the regional and district laboratories to be accredited, especially for the implementation of the NHI. We also want to ensure that there's national coverage by pathologists and have a plan on that. We can't have pathologists in every laboratory, but we will have a system of ensuring that pathologists at least cover every laboratory. And then we are well renowned for the research articles that we publish. And this is, we've got targets for that. And we also got targets for the training of registrar and intern medical scientists. Again, this is the budget for academic affairs. And you can see that there's a very small increase for compensation of employees. So we are going to have to try to deal with the cut in the teaching, training and research grant to cope with this. The next program is the surveillance of communicable disease, which is the NICD. And again, it's a surveillance of prioritized diseases, our response to outbreaks, our accreditation of the NICD laboratories. The NICD is well renowned for being, with regard to being reference laboratories for the WHO, and this places us internationally on the map. We also, with NICD, is the cancer registry, and again, the training of field epidemiologists. This is the budget for the NICD, and what we've tried to do with the NICD is to look at increasing the revenue through other sources in order to be able to look at to cover additional employees that are required, and we are quite concerned about the budget cuts for the NICD because we'll have to look at adjustment of this. The NIOH has been playing an increasingly important role for workplace-based health services, and we're looking at improvement of the turnaround times. But importantly, the NIOH has been very much involved in occupational and environmental health and safety assessments. And it is during the COVID-19 outbreak, it has become extremely important because the unions have requested the NIOH to conduct these assessments in a number of workplaces, which it is doing. We also have a whole lot of occupational health surveillance reports, and to ensure that we world-renowned, we are also looking at SANAS accreditation of the NIOH laboratories. This again, the budget for the NIOH, you can see that it has been quite constrained because of the 16% cut. And the NIOH in particular has been affected by this, but we are looking at strategies to try and deal with this. And then lastly, with regards to Program 5, this is administration, and it deals with all the key issues around financial management. These were the key performance indicators that we often use, and it's the current assets, the ratio of the current assets to liabilities. It's our cash flow, which we have now brought down because of the improvement in our cash flow. Our creditors' days has we are able to keep to the targets or below the targets of what the PFMA has said, and the number of debtors' days we've reduced it for this financial year because we believe that with the payments from the provinces, that this is something we could achieve. And then the turnaround time for procurement is another KPI. We're also looking at a revenue strategy in order to a revenue enhancement strategy to improve our revenue. And of course, we are striving towards getting a clean audit. The KPI, however, we've got it as an unqualified one, but we're hoping that we can improve on that, making it clean. We also got a hotline that where we follow up on any sort of hotline reports that get put in. The next system is around information and technology. There's a number of things that we're going to be doing because this is the crux of our whole system. So we're going to be improving on our bandwidth and improving on our systems. But there's also some very innovative projects that we've got. We've interfaced with the health patient record system, and we want to make sure that that's working quite effectively with the Department of Health, because that will be a game changer for the whole health system. We're also looking at efficiency issues around an order entry system, and in making sure that our uptime for critical systems, we don't have too much of downtime. And then we've got the human resource target around the recruitment process, our compliance with BEE, triple B, double E compliance. And we also have got KPIs then on the number of medical technologists and technicians that are trained, that are admitted and trained in the NHLS, as well as our performance management system and how well it is working. So this is the budget for the program. I need to point out, Chair, that some of these budgets will be journalized because during COVID, some of the functions had been funded out of the Program 5, and that will be generalized back to the regions. So, Chair, that gives you the overview of the APP and the KPIs. If there's anything further to add, Chair, I'm just going to stop the sharing of the screen. So Chair, so I thank you, and we've got the whole team here that will be ready to take any questions from the committee. So thank you, Chair.
Thank you very much, Dr. Chetty, and thanks to the whole team. Dr.
Chair, you're cutting quite a bit.
Jacobs
Can't hear you, Chair.
chaired the meeting. I've just had another family lights where I stay. I also have my questions to ask. You can't hear me? Hello?
That's better, Chair.
Yes, there's a challenge here, electricity and everything. I am requesting Dr. Jacobs, is he on the platform? He's also struggling to log in. Hello?
Chairperson, I don't see Dr. Jacobs on the platform.
Yes, I have a challenge here. Yes, Miss Geller, chair for me, I have a challenge here in the residence. I'm just sorting out some problems here. I will also have a question towards the end, but if I struggle towards that, please continue for me until I be able to sort out this problem here. Okay.
Okay, thank you, Chair. Thank you, Dr. Kembi, for the presentation. I'm going to allow hands as the chairperson noted them, but maybe before, because now I've been given the opportunity to chair the meeting. Let me start with my question before I note you. Sorry, members. My first question to the NHLS, I know that we are faced by COVID-19 and also other department or entity reported that they were also affected. I just want to check with the NHLS, how has the COVID-19 affected you? The second one is about what measures has the NHLS put in place to ensure the increased service coverage in the rural areas. Those are my questions that I wanted to ask, but I'm going to allow members to also ask the question. I'm going to start with number one. It will be Honorable Ishmael, and the second one it will be Honorable Chirwa. The third one it will be Honorable Wilson. The fourth one it will be Honorable Susan. The fifth one it will be Honorable Kwakube. In that sequence, honorable members, you can ask the question to the presenter. Thank you.
Good evening, everybody, and thank you. Thank you for the presentation. I just have a few questions. My first question, is the NHLS prepared to test for the COVID-19 variants that are emerging in other countries? Secondly, what measures has the NHLS put in place to ensure increased service coverage in rural areas? Thirdly, do you have any backlogs right now, and how is the NHLS currently dealing with any test backlogs? I note you planned in the 2021-22 amount for 176 million rand for infrastructure projects. Please, can you give us some detail on what these projects are going to be? Your report actually states that the number of tests for TB and HIV has declined because you've concentrated so much on COVID-19 tests. Now, we know that HIV and TB is quite, pronounced in South Africa. Would this not then result in a spike in TB and HIV rates once testing levels increase again? We've already heard, when COVID started, an issue where, our service delivery on the level of TB and HIV was affected severely. So please, if you could give us a report on that one. Now, the HA report stated several alleged misconduct. Please, can you just touch on these to give us a brief on the report, a brief report on this, and if there's been any consequences, etc. And my last question: does the NHLS have a policy or framework to detect and prevent maladministration, corruption, and fraud that may take place in the entity? Thank you.
Thank you, Dr. Kemi, to your team and you for the presentation. I have a few questions as well. Firstly, I just would like an update on the laboratories that have an issue with functionality or adequate equipment or inadequate equipment across the country. We had asked for this in the previous meeting, but I do not remember with the list being shared with the portfolio committee or with me, myself in particular, because I remember I had asked for a list of laboratories of the 268 that have an issue with equipment or functionality or something of that sort. And secondly, you state that ensuring a corrupt-free organization is one of your obligations as the NHLS. Can we, in the same breath, I just want to get an update on the dismissed employee, the one that committed fraud against the NHLS for 13 years since 2002. I want to know what then has the NHLS done to date to tighten and create a corruption flagging system. If we can get a detailed appraisal in this regard, it would really be appreciated. And I've said this to other entities as well, that I think the time for aspirations and hopes being shared with the portfolio committee just doesn't cut it anymore. If you're going to talk about the fact that you've strengthened systems, tell us which systems these are and how exactly they are strengthened. And if there's a challenge in that regard, then also appraise us. But to just commit to rooting out corruption without actual work being done on the ground, to ensure that the systems are capacitated enough, and if there's a challenge even in that area, then it should be brought to our attention as a portfolio committee, instead of just being brushed over when these things continue. I mean, the fact that corruption happened for 13 years in the entity should really call for much more scrutiny than just a one-line header on the fact that you're committed to ensuring a corrupt-free organization. How will that be done? What has been improved following all of this that has been happening? How will it not be happening again? How will it be prevented systemically so? And another issue, there is an issue I raised also with the NDOH, with the senior medical scientist, Umposileka, who alleges that she's been experiencing immense racism at the NICD. She's raised this quite a few times as well. But what she has been responded to is just dismissals on top of dismissals. Can I just ask, firstly, for, you can write this in a written response because you might not know about the issue in the immediate, but to just look into this issue and just appraise me on the details. Not only the action that has been taken by the NICD, but also how, for instance, how the NHLS can intervene with an investigation of some sort that isn't biased, that is very independent. And I want to know, on how the program of HIV and TB on testing will particularly be affected with the decrease that has been presented here, and in which areas this decrease will then manifest. Which areas will then be affected by this decrease or have been affected by this decrease of testing? And we obviously know the impact of that. Less testing of HIV results in more infections, results in more spread. And then this is really a concern for me. So I want to know in which areas is this decrease manifesting in, and which areas will be affected by this decrease. Thank you very much.
Thank you, and thank you, Dr. Kemi and your team for the presentation. I'm going to actually speak about and raise concerns about the issues that are actually not part of this presentation, but is being brought to light with us with very serious concerns. The first one, there was a government gazette signed by the Minister Mkhize and the President Ramaphosa that stated that the forensic laboratories of the National Department were now going to be integrated with the into the NHLS. Now, I've got serious concerns around this. First of all, that the Act states that members of the NHLS, and particularly doing what they do at the moment, should be a medically accredited employees, and obviously those people in the forensic labs, the chemists, etc., are not medically accredited. They do not actually have not studied, they've studied chemistry as opposed to medical pathology. So that is an issue. Secondly, I'd like to know, in light of this gazette and this regulation that was passed, if you could advise us if any negotiations were held either with the unions representing the people of the forensic laboratories or the members of staff themselves who were going to be affected by this move, what negotiations, if any, were held ahead of the gazette? And if not, why not? If there weren't any, why weren't there any? And my concern is, and I have been with this portfolio for some time, I do not recall any presentation with regards to discussions around this issue, either to motivate it or to discuss the issues or the challenges around it being brought to the portfolio of health. And I'm pretty sure that it wasn't raised in Parliament either. So I have a concern with that regard. And what is the current situation? Are we still in negotiations? When is this move supposed to take place? And my concerns are that because under the present circumstances, NHLS have got a lot of restraints and are obviously trying to recover from a very bad period in this entity. There are a lot of challenges. We are facing a potential third wave. And, these people deal specifically with toxins, drugs, poisons, those kind of things. If you could give us an update of the situation as far as that is concerned, because there appears to be a lot of unhappiness in the forensic laboratories with regards to this. And thirdly, we are seeing a spike, and certainly in certain areas with regards to the COVID, and obviously there's a lot of talk about variants that have entered the country. Can you just update us on the preparations that are being made for the third wave? If it's the prediction always was that it was going to be in the May-June period, and we're obviously entering into May now, and are we properly prepared for this? And if the indications are that it's going to be worse than the first wave or potentially the second wave, what extra precautions have been taken? I thank you.
Thank you. I just want to say, Acting Chair, you introduce all the honorable members with their surnames. And when it comes to me, you say Honorable Susan. I'm Honorable Dr. Tembekwayo, please. Thank you for the presence. It's okay. Let's leave it. The questions are as follows to the NHLS. Corruption is rife within South Africa health sector, and you are also affected as a department or as a sector or as an entity within health. You have been at the forefront of the country's COVID-19 testing rollout, and you had to procure large quantities of equipment, reagents, and PPEs for your staff. And like I mentioned, can you inform us on the fraudulent transactions involving the PPE procurements and the disciplinary procedures to date against the officials who were directly involved? Number two, please take us through your risk mitigations which are in place in your department and how are you adhering to them? The third one, under the expenditure estimates, the test revenue, all other sections have got the titles or topics that are written there. But yet there is one under test revenue, which is called other. And next to other, there's large amounts of monies there for 2021 and 2022, 2022 to 2023, inclusive of 2023 to 2024. And my question is, what are those others? What is the other standing for? Thank you.
Chair, is it my turn? Yes,
Yes,
it is.
Honorable Bakube.
All right, thank you. I have and just a couple of questions. The one relates to the budget cuts for the NICD. I wanted to find out, considering the the emphasized role now of the institution, how does the NHLS generally and the board view the budget cuts, and and how the NICD is going to be able to meet its demands, particularly considering the fact that we're still in the middle of a pandemic and perhaps they'll be very much strained at this time. Then I wanted to then find out, I mean, there was a huge emphasis right at the beginning last year in particular around the work that the NICD was doing in terms of testing and publishing figures. And I just want to find out what the update is on that. What have the systems been cleaned up? How does it work? How often is that data updated? Because, obviously there was a great spotlight on the NICD at the time, but it's since, become part of what is published on a daily. So I would like to know, I mean, what tests, how many tests are we looking at? What is the ratio between private and public labs? And also, on a daily basis, what kind of testing are we doing? Because we're starting to see now, I know in the past couple of days, we've been getting reports that there has been a slight uptick in positive cases. I think yesterday it was about 2,000 cases, if I'm not mistaken, new cases. So I want to understand, because obviously that depends on how many we are testing. There was a time where we were breaching 30,000, 40,000 tests a day, but that was at the height, for instance, of the second wave. So what are we ranging at this point in time? Then thirdly, the surveillance work. I've been asking this from the SAMRC and SAPRA, and now I want to ask the NHLS. Firstly, I mean, how are these institutions speaking to one another? Is there any collaboratory work in terms of, in particular, when we are looking at the advent of, or the possibility of an emergence of the B1617 variant in South Africa? And because, I mean, SAPRA is saying that they themselves, they do some kind of surveillance work as well, and they are encouraging manufacturers to manufacture vaccines that could be effective against new variants. So I would want to understand, what's the role of the NHLS, or well, rather the NICD? Is it just merely surveillance? Is there any kind of work, collaboratory work between all three institutions in this regard? Because I think it's quite important as a country that we get ahead of the curve in this regard. And then the last thing is one of the things that the institution has been dogged with over the past couple of years is provincial debts. And I just wanted to find out what that backlog looks like now, since we last met last year. Thank you.
Thank you, Honorable Kwahube. Let me hand over to Dr. Dlomo, our chairperson. Over to you, Chair.
My dear sister, you are doing well. Please continue. Can you allow me to ask my questions? One, Dr. Chetty, in your presentation, you are showing that there is a high failure rate of the registrars in the program. Now, you did not indicate what are the challenges. Is it maybe you don't have mentors, consultant, lecturers, or what are the challenges? So someone was calling me a rate amongst the registrars. Number two, the relationship that you have with provinces, your clients, is it now sound? Because you are right, 5, 6 years ago, it was not a very sound relationship. Are you doing everything to make sure that the relationship stays strong? Because that is your base of revenue collection. The last one from my side, you are showing a slide there that talks about the district laboratory, regional laboratory, tertiary laboratory. Are you naming them according to whether this one is based on a district hospital, tertiary hospital, or the scope of work is different from those? Those are some of the clarity-seeking questions I do have for you.
Are you done, Dr. Dlomo?
I'm done, Chair. Please continue. I still have a challenge here in terms of where I'm staying. Please continue getting them to finish off. All my colleagues are asking questions and then the response from the end.
Thank you, Chair. Thank you, honorable members, for raising these questions. Are very important. Now I'm going to allow Dr. Chetty and the team to respond on the question that we have raised. Dr. Kemi. Over to you, Dr. Chetty. You can now respond.
So thank you very much, Honorable Chair. I'm going to ask sort of various members of the team to come in on some of the questions. But let me just take the questions that I will respond to. Member Gela, you asked how has COVID-19 affected the NHLS, and I think I need to respond that it has affected us in fundamental ways. Most of our work has been centered around COVID-19. We have been at the forefront of the whole pandemic in being through the NICD, which is as you know, our institute, which detected the SARS-CoV-2 virus right initially, and then we sort of very quickly then from the NICD had to decentralize the testing to the NHLS labs. As one of the members did ask the question as to the NICD doing the testing, I need to point out that the NICD did the testing in the initial part of the epidemic, but the NICD is responsible for surveillance. It's not responsible for the diagnostic work, which the NHLS laboratories are responsible for. And so the NHLS labs are the ones that have been conducting those testing. The COVID pandemic has also, affected us with regard to the other tests that we do, and I'll comment on that. There's been other questions with regard to it. The outgoing chair of the board has also indicated that there's the expenditure on COVID has been huge. And we were in a fortunate position because of the surplus at the end of the financial year that we were able to respond very rapidly to the epidemic. It's of course affected us with regard to a number of our workers also contracting the disease, and we've been striving to ensure the workplace safety and ensuring that we look after our workers' health and safety. But I think also it's quite often we just seem to be responding to, or we're known for our diagnostic tests and surveillance, but the add-on services that we've brought at the expense of the NHLS, and it's been a value-add service to the provinces, such as our call center. Everybody takes the 029 number for granted. We have got a number of nurses that the NHLS employs at this call centers on a 24-hour basis. And it's unbelievable the number of calls that get taken by these call centers, which is a service to the public. As an example, on one night in March alone this year, between 11 o'clock and 6 o'clock in the morning, we had 5,000 calls that were taken. And it just shows how we are able to reach out to the people during their moments of need. We also have a doctor's call line to provide advice. We also provide a call center for results. Our mobile services has also been quite well known, and again, it's done at the expense of the NHLS as a value-add service, which has been able to reach out to communities and improve access quite dramatically. So Chair, I think we can write a whole textbook on how the COVID-19 has affected us. But again, also the role of the NICD in the surveillance has been extremely important. It's also in the epidemiological work that it's been doing, as well as the monitoring of hospitals. And it also gets taken for granted, Chair, the data that gets put out. One of the members did mention this, but the fact is that South Africa and the NHLS has been able to produce data on a daily basis, timeously, with just one small or two small hiccups along the way. But that's quite phenomenal. We've been able to hold our own internationally with the kind of data that we have and that we're able to give. So Chair, I'll stop there for that question. The service coverage in rural areas, I think Member Ismail has also asked that question. As I've indicated, we're the only pathology service that covers the whole of South Africa, and that has a huge footprint with regard to in the rural areas. We cover every clinic throughout the country, with a very efficient logistics system that brings samples from all of those clinics. But we've also been concentrating on improving the services in the rural areas. So, for example, in the Northern Cape, initially, if you recall, in the initial portfolio committees, members raised the fact that Western Cape was doing the COVID-19 testing, but we capacitated the Northern Cape, and now there's a huge amount of testing that's going on for COVID in the Northern Cape, and we're continuously looking at expanding our services in the rural areas or making sure that there is coverage. Chair, the member Ismail raised the issue around, is the NHLS prepared for testing around COVID? And I think that we've shown already that we are more than prepared. At the height of the pandemic, members know that we reported on the backlogs. We have no backlogs at present in any of our laboratories with regards to COVID-19. We've shown that we've been able to effectively deal with the second wave. We've expanded our capacity. We're very confident that we are able to deal with that. And I need to point out that one of the members asked a question on the numbers between the public and the private sectors. We work very closely together, and we can confidently say that we can conduct over 50,000 tests per day. And the NHLS has also been able to prove that a vast majority of those tests we are able to do within the NHLS. With regards to the backlogs, member Ismail, we have no backlogs in almost every one of our tests except for paternity testing, and that's something that we're addressing. So there's about 3 centers that do paternity testing, and there is a backlog with regard to that. We've reduced the time of the backlog, but it is a challenge that we have to sort out. Member Ismail, the infrastructure projects, we have got a number of infrastructure projects relating to renovations and to mobile, well, not mobile, park homes for certain of the clinics where accommodation is problematic. But I want to suggest that we give this to you in writing as to what are the infrastructure projects, rather than going through the details. With regards to the HIV and TB tests and the impact of COVID on that, I need to point out that there hasn't been a decrease in the number of HIV tests. We've been quite pleased about that with regard to viral load and CD4 counts. Our biggest impact has been on the TB tests. And we are as concerned as you about the decrease in the TB tests. We've analyzed the reasons, and they're multifold, some of which was that patients were very scared to go to hospital because it was, they're concerned about getting additional infection. And we saw a huge drop in the number of individuals who went for TB testing. As a result, we are looking at a TB surge program, which we've been discussing with the provinces. And we are also looking at the utilization of our mobiles, which are going to be proved to be very useful in going out into communities in order to look at increasing that TB testing. It has been improving slightly, but we think, and we firmly believe that if we have a concerted approach to TB, as we did for COVID-19, then we've got a good chance of eradicating TB in this country, and that's something that we are striving for. There's been quite a number of issues around the alleged misconduct and the fraud issues. This is a governance issue, so I'm sure that Professor Book may want to respond to it. Otherwise, I will cover it at the end. But just to say that there's it's because of our very so comprehensive and robust risk mitigation and risk strategy that we have got systems in place that we're able to detect the issue around fraud, and we've been able to act very swiftly in order to deal with this. There's been a question around the disciplinary cases. A number of it is still sub judice because we are in the process, but just to say that there have been dismissals. Individuals have been also suspended and charged and not only in the PPE, but in other fraud cases. We've taken a number of action. Some individuals have resigned after they've been suspended, but we're working very closely with the SIU and the Hawks in order to try to get as many of these cases completed and taken to completion. The member, Chewa, and I'm sorry I may not be getting the honourable member Chewa. I hope I'm getting the titles correct. You've asked about the labs that have got inadequate equipment. Again, just to say that we have gone on a massive project in order to modernize the equipment in a number of our laboratories. Some of our laboratories get used as an example by both the private sector and internationally as being highly automated, fully modernized. and that's part of our strategy for the rest. It will be difficult for me now to comment on those facilities where there is inadequate equipment, except to say that where we get the requests, we are acting sort of quickly to try to improve those laboratories. And as is the issues around the corruption, as I've indicated, that the outgoing chair will speak to this. Honourable Member Chair, with regards to Impor Seleka and the disciplinary issues, I am well aware of it because you have raised the issue with the Minister of Health and the DG in the Portfolio Committee. And just to say that the process is still underway, so it will be difficult to comment on it. There is an appeal process on currently, and there will still be issues of following on the appeals process. I can't predict what the outcome is going to be of that, but there are recourses available to the individual, but we are following the policies to the book with regard to that. Member Wilson, with regards to the forensic laboratories, so maybe just to bring you up to date, the President has signed the proclamation to say that the forensic chemistry laboratories must be incorporated into the NHLS as from the 1st of March last year. No, this year. So 1st of March, 1st of April this year, sorry. This was part of the NHLS Act, I need to point out. So the NHLS Act in 2001 did state that the forensic chemistry laboratories must be incorporated, but it's only been proclaimed for the 1st of April of this year. The National Department has been negotiating with the unions. The unions have agreed to the transfer. I'm just awaiting the signed agreement. That's the responsibility. I can't comment on whether there's been unhappiness or not, because that's the function for the National Department of Health. We have readied ourselves to get the forensic chemistry laboratory incorporated into the NHLS, and we have got a service level agreement or memorandum of agreement with the National Department of Health for this process to take place over the next 6 months in order to ensure that it's done seamlessly, without any of the problems. The issue around the registration of the chemists working in the forensic chemistry lab, we agree with you. It's been an ongoing problem for years, in that you get medical scientists who are not recognized by any statutory body. And so I think that's part of the issue that we are going to need to address going forward. So that's where we are with regard to that. We think that's we know that there's a lot of advantages to the forensic chemistry labs being incorporated into the NHLS. And we're quite confident that we will be able to assist with the number of the backlogs and improving on the efficiencies. We're also going to ensure that the chain of custody is maintained, so that will be done. With regard to the third wave, I'm going to ask Professor Purin to deal with the issues around the third wave and the issue around the variants. So Professor Purin.
Thank you very much, CE, and thank you very much, Honourable Chair and Honourable Members. I will go through, I think there were questions that were in common, so I will deal with those questions collectively, if you don't mind. So with regard to the detection of variants, South Africa is in a very good position in that it is doing high levels of testing on a daily basis. We also have mechanisms to identify clusters and outbreaks, and that allows us, for example, to prioritize not only the testing for PCR, so polymerase chain reaction is used for diagnostic testing. Once diagnostic testing is completed, we then go through a sequence to identify what the variants are in circulation. So, for example, in the case of individuals that have traveled from India, those specimens that were identified will go through a sequencing mechanism to identify what the variant is. We are fortunate in South Africa that we have a network of laboratories that are able to perform the sequencing in order for us to tell what sequence is available. Currently, I am not aware of identifying the variant that was identified initially in India in circulation in South Africa, but we await the results of these tests that are currently being concluded. With regard to collaboration, therefore, I think it's really an appropriate question, and I hope I've answered it in the sense that there are multiple laboratories in networks within the National Health Laboratory Service as well as in the private sector that then collectively put all their data together, and these are uploaded to various international sites, and those are accessible and obviously shared across the various laboratories and various fora in order for us to be aware of what variant or variants are in circulation. With regard to other collaborations, obviously there's a great interest whether these variants will affect vaccine efficacy. So the NICD, together with various other organizations, again, private and public laboratories, are working to identify what those variants are and what how it will affect the efficacy of vaccines. So again, we preemptively trying to determine if we can access these particular variants and the mutations, and then test to determine whether or not the current vaccine rollout program will be affected. I must add again that around the variant that has been identified in India, there is very limited information. And again, it's really association and not necessarily causation that is of concern. But certainly, I think we are well prepared to identify these particular variants. And I think a good example of that was the second wave, where there was early identification of the 502Y2 variant, and that was certainly we further identified this variant in circulation broadly in South Africa. So I think we're fairly well set for any other variants that may occur. With regard to the third wave, if I may, Chair, because I think that was the other linked question. So the NICD is part of a South African COVID-19 modeling consortium. The consortium released a report this week on the third wave. It is very difficult to predict what the third wave would look like and when it would occur. However, I think the overall picture that has emerged from the modeling exercise in terms of scenarios is that in the main, overall in South Africa, we can expect a third wave that may not approximate what we've seen in the second wave. And in particular, if there's enhancement of the non-pharmaceutical interventions, that will really ensure that we don't have a substantial third wave. However, the concern is around Gauteng, where we've certainly started to see an increase in the numbers of cases. And Gauteng is really the outlier with regard to what will happen in the third wave. And the possible reasons behind that are not necessarily because of a new variant necessarily, but the high population density, as well as the fact that the levels of immunity may not have reached to the same extent as in other provinces. Thank you very much. I hope that has covered your questions.
So thank you very much, Professor Purin. With regard to the questions from Honorable Dr. Themba Kayo, the outgoing chair will speak to the issues around corruption. Just to say that we have got a very strong risk mitigation strategy in place. We've been concentrating on improving the capacity for our internal audit and building capacity within internal audit. It's because of our strong risk mitigation strategy. We play a big oversight with regard to compliance in the supply chain area. We've got a hotline that gets used quite, an independent hotline that gets used quite effectively for us to pick up around issues of fraud and corruption and any other maladministration issues. And perhaps, Honorable Dr. Themba Kayo, we can forward that risk strategy to yourself. With regard to other revenue, I'm going to ask the CFO to deal with that issue. Okay, so you'll come in just shortly. And then with regard to the budget cuts to the NICD, as we've indicated, that yes, we are concerned with regard to the budget cuts, but we're very, very cognizant of the fact that the whole country is going into a deep recession, and that we've got to play our part with regard to look at being able to work within the resource envelopes that we have. And we are working on a strategy to look at improving our revenue, other revenue besides the conditional grants, and have been able to motivate for that. We're also aware that the provincial departments' budgets have also been cut, and so that's also going to impact on the services going forward, but we're ready to deal with that challenge. Then also just to say, this is Honourable Member Gwaruba, yes, so you spoke about the budget cuts, and we work very, very closely with both SAPRA and the South African Medical Research Council. We're in continuous contact. So for example, all of the tests that get validated, so all the tests that get approved by SAPRA with regard to COVID-19, that work is done by us. And then with regards to the MRC, we are working with them on the seroprevalence studies that have been done, the work that has been done on antigen tests. We're very much involved with the sequencing and the detection of variants, as Professor Purin has pointed out. In fact, I mean, we do the majority of the work together with some of our partners. So Chris, for example, works closely with the NHLS lab in Nkosi Albert Luthuli, and the NHLS has been involved in the detection of the South African variant that Chris had discovered, and I think that wasn't as widely publicized, but the specimens also come from us as well. Then, Member Gwarube, I need to point out that we are not involved with the mortuaries, either the forensic pathology mortuaries or the ordinary mortuaries. Those belong to the provincial departments of health, and they don't come with the forensic chemistry labs. That's a completely separate thing that won't come to the NHLS. So we're not involved with any of the backgrounds there. And then with regards to the issue around the high failure rate in the district labs, I'm going to ask Professor Koleka Melusana to respond to that. But just suffice to say that our relationship with the provinces is extremely strong. We're in continuous contact. We work very closely with them. And this is shown in our very, very improved collection of revenue. We work very closely with them, and because they know that our systems are good, the revenue that we get from the provinces has improved dramatically. We also have wiped out the historic debt in a number of provinces. Gauteng's historic debt will also be cleared up shortly. Some of the other provinces don't have any historic debt at all. The only problem that we still have is with KZN, and we're working on that. But we're quite happy with our relationship with the provinces. So can I ask Mr. Jonas Shai to just respond to the issue of revenue, and then Prof. Melisana will come.
Thanks. Good evening, honorable members. Good evening, honorable chair. With regards to the questions relating to the estimates, the expenditure estimates, and around just what the other income is actually speaks to, it speaks to, for the 2021, that particular line item there includes funds that we had received from the Solidarity Fund to the tune of 250 million. But in essence, over the medium term, that particular line item is used for the teaching income, and secondly, the realization of income received in advance. So these would be some of the other conditional grants that we receive outside of the transfers that we receive from the Department of Health. Thanks a lot.
NHLS, thanks.
Sorry, Chair, just Professor Melisana's walking towards the seat.
Good evening, Chair, and good evening to everybody. I will look at the pass rates. Maybe let me just start there. And really just to say to Dr. Lomo that if we recall, we really have had serious issues with pass rates of registrars. And so what then happened was that apart from the support that we then ensured was happening from within the NHLS, where we have got a training platform, which is virtual, where we are able to actually train registrars across the platform using the experts within the NHLS. And this other thing that has happened is that the whole curriculum of registrars was reviewed by the different disciplines to ensure that the scope is very clear, as well as ensuring that registrars understand what's expected of them. The other thing that happened is that the examination structure was changed very drastically, actually. And for this year, for example, the bulk of the examination has really been transformed to more multiple choice questions. And so we are all looking forward to see how the results are going to look like, because the registrars have just written their exams and they finished their practicals last week. So we're waiting for results. But having said that, we already saw improvements in last year, because from what we were seeing as pass rates sitting around 23, 30%, last year the pass rates really, even though they are not where we want them to be, but there was a significant improvement just across the disciplines. In that, for instance, in virology, yes, there were few people who wrote, but there was 100% pass. Micro, hematology, and anatomical path was sitting around 50 and 55%, and chemical pathology set at 75% last year. I know already that for this year's results, for instance, an example, because I'm closer to microbiology, there were a total, for the first time, of 19 registrars who wrote micro, and all 19 of them passed the written exam. So we're just waiting to hear how they have performed in their oral, in their practical exams. So there seems to be a definite improvement in the pass rates. And then the other one, I thought I could just add, there was a question about the outputs, publications, within NHLS, how we're doing insofar as that is concerned. And you will notice that if we're looking at the annual reports, for instance, in this last financial year, we're able to publish 70 articles, 70 manuscripts more than the previous year. So we moved from 600 to 670, and we actually had targeted 650. So we as NHLS, and that includes NICD and NIOH,
And for this year, we can see that there's a significant increase in outputs, also driven specifically by the COVID pandemic. I think those were the two
district labs.
Oh, and then the district labs. The naming of the district labs is really following the hospitals where the labs are based. So we'll have labs at provincial tertiary hospitals, and that's what we call them, and labs at regional, as well as labs at district hospitals. Thank you.
So thank you, Chair. Professor Book would want to come in. So Chair, can I also just say that we've been joined by Dr. Gerard Koorsen, who's the Deputy Chair and Acting Chair for the Finance Committee. He's joined us later on.
Great. Thanks, Dr. Chetty. I just want to check that you can hear me.
Yes, we can.
Yes.
Great. Thank you very much. Just one or two comments before I respond to the corruption issues. Just in terms of the laboratory's equipment, you just need to, and functionality, as we've been discussing, it's important to recognize that you don't offer, you have district hospitals, regional hospitals, tertiary hospitals, and academic hospitals, each offering higher levels of services with more complex procedures being done, surgery, equipment, and specialists. So we have the same layering in the NHLS. So not every lab does every test, but every lab is equipped to do all the tests required and is functional at the level that it provides. And then if we need higher level services, we transport the specimens. So in terms of the corruption, there was a word about 13 years, but certainly as a board, we identified corruption amongst the former CEO and CFO in early 2017. So in terms of that, you asked us what action we've taken and what happened. As soon as we identified it, I, as the chair of the board, laid charges with the South African Police Service, and then we tried to brief the Hawks on the matter as well. We suspended the officials, and we undertook disciplinary hearings. The CEO, CFO were dismissed for that corruption. The head of internal audit and risk was dismissed for dereliction of duty and misleading the board. And then 3 other managers resigned in the face of their disciplinary hearings. In addition to that, but what I am pleased to tell you is that they are now out on bail, and they have been charged and with offences in relation to one of the cases, and they are all out on bail at the moment. In addition to that, when as the chair of the board, together with the CEO and the company secretary, we took it upon ourselves to meet with the head of the Special Investigations Unit, Advocate Tibe, and we informed him about the corruption, and we asked him if it was possible for the SIU to get involved. The SIU have been involved, and we are in the process of working on different cases with them. And what I should emphasize is that Advocate Motibe complimented us. He said it's very unusual for a public entity to bring matters to their attention, and commended us on our efforts in this regard. We have also made all our forensic audits available to both the SIU and the Hawks, and we continue to work with them. In relation to the PPE corruption, or maybe just in relation to that as well, we put in a number of measures to strengthen our systems, as you asked about. Dr. Chetty mentioned them, but just for example, at the time, a lot of the tenders and procurements were managed manually in piles of paper, and you'd have to pull the file off the shelf, and that's very easy then to make documents disappear, and to sort of track it is very difficult to track what's happening in different things. We now have electronic management systems and databases and a number of other measures that have been taken. I just thought I'd mention that particular one, but Dr. Chetty spoke about others. In relation to the PPE corruption, again, I want to emphasize that we had found the corruption before the President made announcements and the Treasury made announcements in this regard. We had already started the process of investigations and taking action. The CEO initiated a forensic audit, and in this regard, we had independent forensic auditors, and we included in that investigation that the mandate of the forensic auditors was to investigate the board as well as the CEO and others. The forensic investigators said that the board had met all its fiduciary and statutory duties, and that was a legal opinion as well, that the CEO had undertaken her tasks, and had acted to identify problems and to act promptly in a series of manners that were outlined in the reports, including the internal audits and the forensic audits and other matters, and appropriately delegated. But it had pointed out that a number of other staff had either not carried out their duties with diligence. So there was not necessarily allegations of fraud or corruption against them, but rather a lack of taking proper measures to prevent such fraud. And then there were a number of staff who were identified specifically as having embarked on fraudulent and corrupt behavior and collusion with suppliers. And all of those staff were suspended. All of them are at various stages of disciplinary hearings. There are some dismissals, some resigned in the face of disciplinary hearings, some have appealed to the CCMA. So those continue. We continue to work with the Hawks and the SIU, and we are providing all our forensic audits and forensic support to expedite the process of justice in that area. Of course, as a board and as an entity, we can only investigate directly. We don't have access to bank accounts, families' bank accounts, and various other things. We only have access to public data, and we anticipate that the SIU and the Hawks will be able to use their powers of investigation to take this further. They have reported back to us from the SIU that they have made substantial further progress in all of these cases. We are in the process also of setting aside some of the procurements in relation to the powers to do so when the procurements were irregular. So I hope that that provides you with the information you require. I don't know how much more detail the committee would like to ask for.
Thank you very much, Ms. Honorable Kela, for holding on the fort while I was struggling here. And thanks to Professor Bush, you speak very passionately about this program.
Sorry, Chair, we can't hear you.
I can hear you. You can't hear me.
We can hear you now.
Okay, I'm using a gadget that is very fun here. I'm saying, are there any other leaders who still have to give us an input? Or Ms. Kela, have we finished with the responses?
Yes, Chair, we have finished with the responses. I'm not sure whether the other board members would like to add anything who are present.
Thank you, CEO. We don't have anything to add. Thank you.
No, thank you very much, honorable members.
Nothing to add, Kemi.
Yes, Professor.
Chair, there's someone who want to add from the board members. Mariba.
Professor.
No, I said nothing to add, Chair. Thank you.
Okay, all right. No, you can proceed, Chair.
Thanks, Honorable Gela, for really holding the fort while I was struggling with my connection here. Professor Buch, we hear you speaking very passionately about this program, and you have been part of this board. We will hear whether you continue to support them, but we welcome Professor Mphahlele, who is now, I understand, is a chair or is leading in this board. We thank you very much. We had a report from the Financial and Fiscal Commission about you. They almost were commending you for the sterling work that you have done, because the SIU did not come to investigate you. They came to support what you already initiated. So that is actually commendable. We will continue to support you. I wanted just to report, I was in the far-flung part of KwaZulu-Natal over the past 3 days in Bulwa, Pholela, and NHLS was there. And you are correct that you are in areas where no one else is ready and available to go, and you support that. Honorable members, we will need to bring this meeting to a close. We are starting at 10 o'clock tomorrow. May we log in at about 1:45 or 10 to 10, so that I can give you some other announcements with regards to the program. We have another almost a longish day tomorrow, because after the minister, we then have to get the ombudsperson and the Office of the Health Standard Compliance. But thank you very much to the board members. Thank you to the CEO and her team, and to all our honorable members who also are part of this, and our staff. We can then adjourn the meeting. Good evening.
Thank you, Honorable Chair.
Good evening. Thank you.
Thank you very much, Chair.
Good evening. Thank you.
Thank you.
Thank you, Chair.
Thanks. Bye, everyone.
Thank you and goodbye.
Thank you.
Bye.
Thank you. Thank you. Thank you. Bapha abantu baphume bonke.
Slobo.
Ithwile.
Kela. Kela. Kela.